Makes a lot of sense. Let's go now to you, Andy, on line 1. Hi, Andy. You're on the line.
Yeah, hi, Catherine. Anyways, special kudos to the doctor. I mean, he's the first person who I really admire. He tells it like it is, and he's not tripping over his self-aggrandized ego.
Can you ask your question there, Andy?
My question is, how can he be, so right on without, tripping over his own medications that he's promoting? He is absolutely right on, and he has a lot to say, and he is a very, very smart person.
Thanks for your comments, Andy. Let's go now to Al on line 4. Hello, Al. You're on the line.
Yes, hi. Excellent show. Question regarding type 2 diabetes. Is there such a supplement as to rejuvenate the prostate?
Good question,
yeah.
because before Dr. Meschino answers this, there's one thing I want to add on to what Al is saying here, another part to his question. I've actually heard it said that with men, and that sounds so grim, it's not the matter of if they're going to end up with prostate cancer or related problems, but when. First of all, is this true? And then further to Al's question, what can be done about it?
Well, let's talk about the hard facts, and that is that
please.
I can show you areas of the world where the incidence of prostate cancer is more than 80% lower than it is in Canada.
Wow.
Now, when those men from those countries might immigrate and come to Canada or the United States and abandon their traditional dietary behaviors that protected them, it wasn't genetic immunity, and they adopt our lifestyle, their incidence of prostate cancer jumps right up to just like ours, like 1 in 8, 1 in 9 men, and it becomes the leading cause of cancer incidence. And so, after lung cancer, which is the #1 cause of cancer death, but for men, lung cancer is the second leading, or prostate cancer is second leading. So there are nutrients that can protect the prostate gland. That's the first thing to know, and I'll talk about those in a minute. But I want to talk about aging in the prostate gland as well, and then how diabetes can complicate it. But what happens in the male prostate gland after the age of 40 is this. It takes the hormone testosterone, and it more rapidly converts it into a much more dangerous type of testosterone called DHT. And DHT then acts on the prostate cell, causing it to divide at a much faster rate than is normal. So now there's an enlargement of the prostate that occurs because there's a greater number of cells. It's dividing like mad. And that creates prostate symptoms, nighttime urination. You can't completely void the bladder, and the urine stream is weaker, more frequent urination, as I'm saying. But the thing is, when cells divide quickly, they also make more genetic mistakes. That's how hormone replacement therapy increases the risk of breast cancer in women the same way. It causes the cells to divide faster. It's like fertilizer on a tissue. DHT in the prostate gland does the same thing. Cells divide too fast. You end up with prostate enlargement and prostate cancer. The incidence is high. Certain foods can block the conversion of testosterone to DHT. Listen carefully what they are. Soy products, tofu, soy milk, roasted soy nuts, edamame. Soy foods protect you. What else? The indole 3-carbinol from cruciferous vegetables, broccoli, Brussels sprouts, cabbage, cauliflower helps you. In addition to that, there are certain natural supplements like saw palmetto, pygeum, beta-cytosterol, isoflavones, stinging nettle. If you go onto our website at adiva.com and you look at the prostate product that's there, it has all of those ingredients in it. Men at the age of 40 should start taking a formula like that to block the buildup of DHT so the enlargement never occurs in the first place. Now, when you're a type 2 diabetic, often the person has insulin resistance and their fat cells are usually a bit larger, and the fat tissue makes extra estrogens which then support the buildup of DHT. So a diabetic has an extra need to block the formation of DHT, and if you lose weight, do aerobic exercise, you'll stop making as much of that dangerous estrogen. And the indole 3-carbinol and the soy products and ground flaxseed will help the fat cell not make as much of that dangerous estrogen. I know it's a bit complicated, but that's the right answer.
But the thing is, it's not inevitable, as some try to make it seem, and that's the good news. Thanks for calling in with that.